WCNC Charlotte. This is Flashpoint, where power and politics collide and the tough questions get asked and answered.
Thanks for joining us here on Flashpoint. Hope you and your family had a great Thanksgiving. I'm Ben Thompson. Thousands of folks could get access to health care this week. Medicaid expansion finally expected to take effect on December 1st. And it's a battle that has been years in the making. Finally signed into law in March, but it then faced even more hurdles. A provision in the state budget delayed the rollout several months. And now it's actually happening. Joining us now is Nicole Carob. She is the Executive Director of Policy Development for the North Carolina Healthcare Association. Nicole, thanks for coming on. We appreciate it.
Thanks, Ben.
All right, so put this in context. We talk about this a lot in the news, but I don't know that we always do we don't do it justice when it comes to explaining how big a deal Medicaid expansion is here in North Carolina. Help us understand.
So Medicaid expansion is going to allow for 600,000 North Carolinians to be covered by insurance, which I know sounds like an unfathomable number, but that means your neighbors, your friends, people in your community who aren't able to go to a doctor, aren't able to have those procedures, the things that we may take for granted as me, myself being covered by health insurance, they're finally going to have access to all that routine care that is so important for our health and wellness.
And even though I know this is good news for hundreds of thousands of people, and I don't want to dwell on the bad news, but I also want to point out, and this had been a decade in the making, and that Republicans were not on board for the longest time. Then they did sort of have a change of the heart in the last few years, passed this legislation. But what did these delays, what did it mean for those 600,000 people you just mentioned?
Yeah, I mean, you're right that to get to this point of getting Medicaid expansion took a very long time, but we did see quite a shift. And yeah, for those individuals, they simply did not receive healthcare coverage. And, the individuals are a really important part of this. Also, employers and hospitals are impacted as well in that they are receiving now money to be able to continue to provide care to these individuals, but also to be able to pay their employees. So we know healthcare is a business. It's one of the largest businesses in North Carolina. And so this is going to have sweeping impacts for both patient care, but then also on the back end for those who provide the care to patients.
And for people like yourself and like me who have health insurance, it might be difficult to understand, but explain who these people are. These are people in most circumstances are working and have a job. They just can't afford the health insurance.
You totally got that right. So these are people who are working full time, who might be self-employed. We've heard of the kind of those in the coverage gap tend to be farmers, fishermen, veterans, people who you may look at them and think, oh gosh, they have to have health insurance, right? But they are truly in that gap of people who do not. So it is going to open up the ability for them to be able to see a primary care physician, to get that needed surgery, to be able to get all those, appointments that we may take for granted.
Which is just a game changer for anybody. How do folks know if they're eligible?
So everyone will have to apply come December 1. So you can apply online. You can go to your local DSS office. So it'll be really important once December 1 happens for folks to see if they are eligible. And, really December 1 is the first time everyone can do that. It's not before. So, definitely check in with ePass or with DSS and see if you are an eligible candidate.
And then what does the process actually look like of actually getting on Medicaid? It's December 1st. You go to the website, you sign up. Then what happens?
Yeah, then you will be notified if you're eligible or not. And then once, if you are eligible, you are going to be able to start seeing your care providers and see who is in network with your care provider. So I know that the state and others are working really hard on that communication in that transition, and hospitals are ready to be able to provide care for newly eligible folks on Medicaid as well.
And for folks who are not on Medicaid and they don't need it, why should they care? What impact will this have on the larger population, the larger economy?
Yeah. So, taxpayer dollars are already funding people who don't have access to health insurance, whether it's through, the health insurance premiums that we pay or through just our general, money that we are going to be able to now have more people covered, which means that they're going to be able to get their ongoing routine care. And that's going to have not only a positive impact for people who may still be able to work, who are not sick, they're not taking sick days, but it also means that for that care that's already being provided by hospitals where they aren't receiving any money, and now that they will be providing care for people with Medicaid, they're going to be able to reinvest that money into their communities, into their staffing, to be able to continue to improve and enhance the services that they already have and that they're offering to the community. So, we've seen that in other states where Medicaid has been expanded, it has helped the economy, it has helped job growth in healthcare. So we wouldn't expect anything different in North Carolina.
Now, what would your message be to lawmakers after a decade and delays of this? What would your message be now that it's finally happening?
That we did it, and that we are so thankful that we are to this point and that we're doing it, and that now it is important that we have expanded Medicaid to make sure that North Carolinians have great access to care. That doesn't just mean health insurance, it also means being able to get appointments timely, to see quality providers, and to make sure that our health care is affordable. So we have taken one really important step, and we've still got steps to take, and we're excited to do it.
All right, Nicole Karam. Nicole, thanks for coming on. We appreciate it.
Thanks, Ben.
All right, more Flashpoint after this.